you take. After looking at all of those out-of-pocket costs that you'll have to pay, you might be wondering what Medicare does coverage. Well, it covers the first 60 days of hospitalization minus deductible. It covers 80% of your doctor bills, and it covers some preventative services. The best reference for finding out what Medicare covers is Medicare and You 2012 booklet, or I guess it would be the 2013 booklet now. To get it, you call that 800 number or go to that website, medicare.gov. That's where that two-track slide earlier was copied from. So what does Medicare not cover? The Medicare and You booklet spends over 20 pages talking about what Medicare covers and only one page talking about what it doesn't cover. I'm not talking about partial payments. I'm talking about no coverage whatsoever. And it's the list of services you see now. Now, some of these things you can avoid. Cosmetic surgery is optional, for example. If you never go outside the United States, you don't have to worry about that. But some of these other things may be necessary. Dental work, eyeglasses, hearing aids. These are things you'll have to take care of on your own. This is where private insurance comes into play. Private insurance can cover all or part of your deductibles, those hospital costs after the 60 days, and the 20% of doctor bills that Medicare doesn't pay. And of course, all prescription drug coverage is offered through private insurers who contract with Medicare. Medicare alone doesn't cover them. Depending on the drug plan you choose, it may cover the $320 deductible, and it should cover most of the cost of certain drugs during the initial benefit period and the catastrophic coverage period. But it won't cover all drugs. Each plan has its own list of drugs called a formulary, and it won't cover much, if anything, in the donut hole. Medicare supplemental insurance, commonly called Medigap policies, are issued by private insurance companies and are designed to fill in the gaps that Medicare doesn't cover. Although they're not affiliated with Medicare, they do have to follow certain federal and state laws designed to protect you. Medigap insurance companies can only sell policies that are standardized. They're identified by the letters A through N. So if you buy a Plan F in California, it'll offer the same benefits as a Plan F in New York. However, the premiums can vary considerably from company to company and from area to area. For example, in one Florida county, the monthly premium for Plan F ranged from $192 to $475 or $65 per month for exactly the same policy. That's why it's important for you to carefully evaluate Medigap insurance and not pay too much for it. This table shows the various benefits for the various plans. This is in that Medicare and You booklet was talking about, so you don't need to memorize it. The main thing to remember is that when you're looking for a particular plan, it will be exactly the same as every other plan offered by other insurance companies. So you want to make sure you don't overpay for the same policy that you can get elsewhere for less. Medicare Advantage plans, also called Part C, are offered through private insurance companies that contract with Medicare. Medicare pays an amount to the plan for each member's care, and the plan is responsible for providing care. You may have to use the network's doctors or hospitals. You'll want a plan that includes prescription drug coverage. You may even be able to get extra benefits like vision. But the benefits and cost sharing for a Medicare Advantage plan are different from original Medicare. So again, you'll have to shop carefully and choose a plan that fits your needs. The one we see most often in our area is Kaiser, but there are many others as well. This is just a reminder, once again, to shop carefully for private insurance. Medigap policies are standardized, but the premiums vary considerably. First, choose a plan that offers the coverage you need. Plan F is the most comprehensive plan. Then choose a reputable company offering the policy at the lowest price. Before signing up, check with your provider's billing department to make sure they can process the billing for the company you choose. Otherwise, you'll have to pay the bills yourself and then file a claim to get reimbursed by the insurance company. You don't want to do that. The drug plan benefits vary considerably. If you don't take any prescription drugs at the moment, you can choose the cheapest plan available. You can always switch to a more comprehensive plan later. If you do take prescription drugs, you'll want to examine each plan's drug list or formulary to see what kind of coverage it provides for the medicine you do take. And the same with Medicare Advantage plans. Evaluate each plan's offerings and costs to make a clear choice about which private insurance to go with. Now we come to Part 3, planning for higher health care costs in retirement. Out-of-pocket spending on health care increases with advancing age and declining health. In 2006, beneficiaries aged 75 and older had higher out-of-pocket spending than elderly beneficiaries aged 65 to 74, and the non-elderly disabled, reflecting higher health and long-term care needs of Medicare's oldest beneficiaries. Beneficiaries in poor health spend over $1,000 more of out-of-pocket on health care in 2006 than those in good health, and over twice as much as those in excellent or very good health. Here's what a typical month Medicare budget looks like today, considering premiums only. The Part B premium is $99.90. The Medigap Plan F is about $200. The Part D drug is $39.40 for a total of $339.30 per month per person. Considering both premiums and out-of-pocket costs, the typical healthy Medicare beneficiary might spend over $5,600 per year, $4,000 in premiums, $800 in non-covered prescription drugs, and another $800 in out-of-pocket expenses for dental, vision, and alternative care. That's $467 a month. What can cause your health care budget to change? Two things: inflation and the possibility of getting sick. As health care costs continue to rise, insurance premiums go up, and the non-covered services that you need for yourself get more expensive. If you get sick, you may need more expensive prescription drugs and have to spend so much time that you find yourself in the donut hole, having to pay many thousands of dollars a year for medications. There's also the possibility that as you age, you'll require more non-covered services such as major dental work, hearing aids, or long-term care. How can you plan for rising health care costs when you might be on a fixed income when you retire? One way is to set aside enough funds to cover your future health care costs before you retire. Fidelity does a study every year to determine how much the average couple might need at the start of retirement to fund all their future health care costs, not including long-term care. They say that the average couple will need about $240,000. The Employee Benefit Research Institute did a similar study with slightly different variables and came up with $124,000 for men, $152,000 for women, and $271,000 for couples. But these are just averages. If you live longer than the average or you have different health care needs, you might need more. Remember, these amounts do not include long-term care.